Good evening. The Centers for Disease Control and Prevention has dropped the number of vaccines it recommends from 17 to 11.
Now, vaccines for the flu, rotavirus, hepatitis A, and hepatitis B, among others, no longer have the CDC's recommendation for all kids. Today, I spoke with local officials to learn about their reactions and look ahead to what this could mean for young people's health. Dr. Lesta Whalen, who works in pediatric critical care for Avera Health, makes clear how she feels about the new recommendations.
Myself and I think the general pediatric provider community is just really dismayed by the recommendations that have come out. We feel that they're dangerous to the health of our kids in this country.
According to the U.S. Department of Health and Human Services, the changes come in response to President Donald Trump's request for a review of American vaccine guidance. HHS Secretary Robert F. Kennedy Jr., a skeptic of vaccines, said in a statement that the move, quote, protects children, respects families, and rebuilds trust. Whalen roundly disagrees. Do you think this is going to result in more sick kids?
Yes, I do. So vaccines, especially when the ones they've recommended, are taken off of a recommendation and now more of a discussion with your provider. These are vaccines that are 80% effective in keeping kids out of the hospital. So even if they get sick, they stay out of the hospital. They are not as ill.
Dr. Jeremy Cowles, Chief Medical Officer for Sanford Health, also has concerns.
I think there are risks for us not recognizing what illnesses may happen to children that we don't have the ability to track well. And I'm very concerned that it's going to hit our people of greatest need the hardest.
And despite the new CDC recommendations, Cowles is looking at what has not changed.
If you look back to our experts, if you ask the American Academy of Pediatrics or the American Academy of Family Medicine, those recommendations haven't changed. Furthermore, there's no new evidence out there regarding vaccines. There was no new papers or studies that came into this last portion of recommendations.
The CDC has organized childhood vaccinations into 3 groups. One group of vaccines is recommended by the CDC for all kids. A second group of vaccinations is recommended for high-risk groups. A third group of vaccines is designated as, quote, based on shared clinical decision-making. We also heard from Justin Orpon, Deputy State Epidemiologist in South Dakota, on this topic today. What he shared with us will be included in this report on our website. Also, the American Academy of Pediatrics discusses the appropriateness of vaccine recommendations on their website. A link to that is also in this story on KELOLAND.com.